Hi, I'm Suze. I'm the co-founder of a fertility and family building benefits company called Sprout Family. So we started Sprout really because we wanted to improve Canadians' access to fertility and family building care. So that's like fertility, surrogacy, adoption, really any pathway to parenthood. And so that people feel supported regardless of their age or gender, sexual orientation, and have the support that they need.
And is this obviously I've like this idea we've heard a few other times in regards to like the idea of needing more investment through organizations. Is this a more common benefit in the States? Is it not really common anywhere? And this is kind of not very much talked about, but not really accessible to many people.
No, that's like a really good question. And part of honestly why we started the business is because we were looking at the differences between the Canadian and US landscape. So in the US, there's about 50% of companies that are offering coverage for
Wow.
fertility benefits broadly. So, of course, it's like different packages depending on the company. But within the Canadian market, that number is only about 2%. So it's significantly lower. And part of that comes from a general misconception around how fertility healthcare fits into our public healthcare system in Canada. So a lot of times people think like,
Mhm.
oh, we have publicly funded healthcare. So if you have an issue, if you had a medical diagnosis like infertility, you'll get the support that you need.
Mhm.
But that's not actually true when it comes to fertility specifically. It's not federally mandated that the provinces offer support for fertility. So some of the provinces have their own structures, but it's pretty limited and it's not easy for someone to get access to the funded cycles that they might need. So, based on that, where there's like a massive gap in people's expectations in terms of coverage and then what is actually available from their provincial governments. And that's where benefits can then play a big role, right? Because it's something that many people are dealing with and like there's increasing rates of
Interesting. And
infertility,
one
and just
second
many different ways that
here.
people are building their families today.
Mhm.
So trying to find a way that people can have
Mhm.
a benefits package that actually helps provide the coverage that will basically meet those gaps where their provincial care does not.
And obviously, like you said, in the States, this is a lot more common. Is it province? Obviously, province is all a little bit different. Why do you think it's such a big gap? Obviously, government plays a big role, but is it just because in the States, a lot of healthcare is privatized, so have more choices, where in Canada, a lot of people default to like, well, it's kind of covered by the Canadian government. I don't have to do much here. Is that a big like challenge or education part of it? Thinking that maybe many organizations think like, hey, this is already covered. Is that a big part of the process of like educating the public? Like, hey, this is not as accessible as you may think as a founder of an organization or as a employer who just assumed this was easier to access.
Yeah, no, it's that's exactly it. Like it's a combination of education and access. So on the
Mm,
education side, a lot of people like don't have an understanding of how these things are funded. You know, you'll
mhm,
hear things like adoption is expensive or surrogacy is
mhm,
expensive, but like people don't really know what does that actually look like. It's not something that many people will plan for when they're thinking about growing their families in the
mhm,
future. And so because of that, it's not something where necessarily there's a lot of push from employees until they actually hit the point where they're in need of this type of care. And then unfortunately, by the time you're at the point where you maybe are looking for this care, there is still a bit of a stigma around it,
mhm,
right? It's hard to be the employee that raises your hand and says like, oh, I found out that my fertility treatments aren't covered by the province.
mhm,
So would love for my employer to help support me with this medical care. Because obviously
mhm.
then you're putting up your hand and you're basically saying like, hey, I'm probably going to go on parental leave soon if things
Yeah.
work out well, right? And that's a really tricky spot for an employee to be in. And so there's just because it's stigmatized and not something that people deal with on a regular basis in their lives, it generally there's a lack of awareness of the fact that this could be an issue. And then on top of that, the US is much further ahead on us in terms of actually innovating in this space.
Mm,
So in the States, like between 5 and 10 years ago was when there first started to be a few companies popping up that were thinking about fertility and family building access. And for them, they were able to market with a pitch that was basically like, if you're not providing good care for fertility, you're going
mhm,
to have the cost show up in your benefits plan because someone is going to go through like an unhealthy pregnancy, not go to term, end up in the NICU. Like there can be a lot of downstream impacts of
Mhm.
not having like effective reproductive health care. So it made a lot of sense to build into their benefits package. They already in the US were going to have to cover the cost of those deliveries.
Mhm.
So you'd want to make sure it was like a healthy and safe delivery from the beginning. So it makes a
Mhm.
lot of sense to be able to like sell that that value proposition. In Canada, obviously, it's a little bit different. Fertility is private. The rest of our healthcare system is public. And so that's where it becomes a little bit more difficult for an HR leader to say, okay, how am I going to benefit or how am I going to be able to like really get the best support for my teams? And does this actually make sense for me to be providing this additional support? Like, where
Mhm.
is the return for me? So I think what's been,
And
or go ahead.
I was gonna say, oh, keep going. But I was gonna say, like, obviously, we're talking about organizations. What made the idea kind of come from more of a B2B side rather than maybe a B2C side or direct to consumer model? Kind of how did that come to play was kind of the question I was going to go ask after.
Yeah. So I think a big part of that is that we wanted to solve for access broadly.
Mhm.
The top 1% of Canadians, they're going to afford the care that they need, right? Despite the fact that fertility is private and it is very expensive. Like a typical round of IVF will cost, or sorry, IVF is in vitro fertilization. A typical round will cost about $20,000. Many people need multiple cycles to be successful. So you're talking about a sixty to $100,000 cost potentially. But the most wealthy Canadians can afford that. Of course, it's like something that really, really matters. You're going to make it like pay for it as required. The issue is that it's not something that most people can afford, and it's not something that most people will save for. And so, when we
Mhm.
wanted to go out and solve this problem, if we're really going to solve for access, then a big part of that is solving for the financing side, and having it come through the benefits is like a way to improve the accessibility in a way that's really equitable across the employee base, regardless of where you stack up within that employee base and what your income levels are.
Yeah, it makes a lot of sense because it's one of those things where, like you were saying, if you can afford it, you're doing it. But most Canadians aren't able to afford it, and benefits is a thing that I think typically are quite underutilized. Obviously, coming from digital mental health in the past, it was something that no one really did mental health benefits. COVID happens. Now everyone's realizing, oh, I need to support my employees because there's a lot of downstream impacts. People are taking more sick days. There is more short term disability. How can we be preventative rather than a reactive approach? And I think that's a lot of the challenges we face in general in the healthcare system, especially in Canada.
Yeah, and I think that mental health
So,
actually
mhm,
was an interesting like unlock in terms of this like
mhm,
distribution model broadly. Like the cases for mental health over the past 5 years has really helped employers understand the multi-layer impacts of like if you have healthy and well employees and you're being proactive about it, that can avoid the downstream
mhm.
impacts of short-term disability or other claims showing up on your benefits package. So it's a similar thread when it comes to fertility and family building care. Like the people that are going through it, it's known to be one of the most stressful and traumatic things that people go through in their lives. The reporting of mental health claims for people that are going for fertility is really, really high. And so part of what we want to do is like, yes, let's help unburden the financial aspect, but then also let's make this journey as efficient as and effective as possible. Right. So our goal is to basically one, provide the finances, but then also provide a digital health solution to help people navigate the journey and get to their goals really effectively because they're working with quality providers. They understand what's ahead of them. They're able to make informed decisions and not just react to what's coming up as they're going through the journey, but really thinking about it at the very beginning. So what we want to make sure is that like one, people have the resources, but they're using those resources as effectively as possible.
I mean, that is always a huge issue is that for a lot of things, especially in healthcare, it may be possible to get, but navigating the complex health ecosystem is half the battle. And that's, I mean, one thing I saw a lot was like a lot of the benefits we were speaking about in the past, like, oh, you could always get them, but no one knew how to access. You had to go through a 1-800 number, call someone else, get a referral. So even if it's on paper, not accessible, but possible, it's not, like you said, it's not very accessible because there's so many hoops to hop through and many, it's just confusing world to navigate, especially in a high stress situation where you may not want to talk to your HR leader at your company and ask all these questions because it's inferring that, oh, hey, I'm probably going to go on maternity leave or looking to get pregnant, which is always a tricky conversation to have. So, obviously, in your past, you've done operations, you've worked in the consultancy world a little bit. What made you go from, hey, I have a pretty impressive resume and career. I want to do a startup now, or want to jump ship and do something on my own. Was there an impetus for this? Was it a passion, a calling, or was it just something where you started working on an idea and you're like, hey, there's some wheels here, I should fully invest? How'd you go from full-time employee to now all on your own, sailing the world of entrepreneurship?
Okay. I missed the start of that or the end of that, but I think I got the question. So when I was first thinking about whether or not to actually jump in and do the founder role, my initial thought was like, no, that's not for me. And I think that you really underestimate the fact that in your own mind, there's a lot of doubt and imposter syndrome, like all the things that are going to hold you back from having the confidence to be able to go forward with it. At the time, I was wrapping up a previous role where I was head of operations at a tech company. They were going through an acquisition. It was pretty obvious that that role was coming to an end. And so I had the time and space to think about what I wanted to do next. And I remember talking to my founders from that company, and I was like, oh, I'm going to go join some sort of pre IPO company, go through the IPO experience and get that checked off on my resume. And it was actually those
Mhm.
founders from that company that called BS on it. They were like, no, you're
Mhm.
not. You are someone that likes to build. You like to be at ground zero. And so why don't you follow that and use this opportunity to go
Mhm.
forward with it? And it was honestly having them actually call out the fact that I was lying to myself and saying like, oh, I just want to go join a big, well-established company, that gave me the
Yeah.
confidence to say like, oh, maybe I actually can consider another pathway in parallel to those conversations and just like broader career questions happening. I was already digging into this problem space because of like my own personal challenges accessing
Mhm.
reproductive healthcare. I became like really frustrated as I learned more and more about the industry, the differences between the Canadian and US market. I had friends that were in the US that were like, oh, I went and froze my eggs because XYZ big tech company paid for it.
Mhm.
And I was like, why is that not happening in Canada? Like, we are facing all the same challenges of, women and men being in the workforce longer before they choose to have children. Like, there's very similar macro forces at play here.
Mhm.
So, how come the Canadian market is dealing with it so differently? And as I was asking those questions, one of my other coworkers from that tech company was asking similar questions. She had similar reproductive health issues.
Mhm.
And it felt like it was really taking over our friend groups, the conversations we were having. There were so many people that were stressing about this because we saw people older than us go through really horrific family building experiences, right? Where they were shocked by
Mhm.
the fact that that they needed support. They weren't able to get the support they needed. It was very, very expensive. And so I think it was a combination of one, having a vote of confidence from people I really, really trusted, my old co founders. And then also that was paired with me and my new co founder. We were both so passionate about this industry, and we realized that we could bring something different to the conversation.
Mhm.
There's obviously a ton of people that are innovating on the medical side, which is great. Like, we'd like to know that fertility treatments are progressing, that IVF will be more successful 10 years from now than it is now. That's all great.
Mhm.
That's not my skill set. I can't go and do anything that a
Yeah.
doctor would do. But what I can do is think about the finance, think about the tech, think about the operations, and how to like realign the actual journey that an individual goes through and the way that they get access to the care that they need. So it was a fortunate timing, really, that me and my co-founder were both able to get like jump into this at the same time. And it felt like exciting and motivating to just go after something that we're really passionate about. We kind of both jumped in with the mindset of like, this is a big problem.
Mhm.
We're going to go try and build a successful business that makes a difference in this. But if anything, we're at least going to push the conversation forward a little bit within the Canadian market. And so because we felt like we had that base level like opportunity for success, that was enough motivation to just go out and try.
Mhm. And that always seems to be the case where it's like a lot of founders I talk to, they're like, I never planned on really doing this. And then the problem became big enough where it was something you had to solve.
Mm-hmm.
Kind of being obviously a part of a startup as well and kind of seeing that success. Was there anything that was shockingly hard doing it on your own and maybe surprisingly easy, although nothing's easy, but something where you thought maybe it was going to be a bigger hurdle or bigger challenge that ended up being more manageable than you thought? Anything come to mind?
I think that what has been easier, fortunately, is feeling like we're at a point of market readiness. Like, of course, everyone says there's like three things that matter for a startup: the problem, the timing, and the people, right? And, people, you hope you're the right person. Problem, we knew it was a big problem, but timing is always a big question mark. You're like, even if this is something that is coming up in like as an issue in people's lives, does that mean that like the regulatory and social environment is actually ready to make a change? Maybe, maybe not. And we've been really excited to see the actual pull from the market of benefits brokers, employers, insurance carriers. Many of them are having conversations around women's health broadly. And one of the things we always push on, as like a quick caveat to that, is that fertility is not a women's health issue. It is a human healthcare issue, and infertility is 50% male related. And family building broadly is because people of all different um, combinations are building their families today. And so this is not something that is a woman's issue to deal with. Unfortunately, when it comes to fertility treatments, a lot of that burden will fall to the women. If you're going through IVF, it's going to be the female that will be taking the injections and going through that care. But overall, this is something that like broadly needs to be solved in order for us to deal with the declining fertility rates of our country. So that felt like something where it was already a topic of conversation really this year, starting at the beginning of 2024. And so that's helped us really accelerate a lot faster than I think we expected. So that's been great. Um, on the hard side, I say that kind of the things that I shouldn't be surprised that these things are hard, but these things are hard. Like
Yeah.
fundraising is still really hard. We're coming out of a little bit of a VC winter. And while things are starting to turn now, we're in almost the fall of 2024. There is like a bit of a temperature change. It definitely still feels like it's slower than it maybe was. And especially having had startup experience from 2021, 2022, when it was a lot faster pace. It felt a little bit shocking how difficult going through a fundraising process has been. And then I think the other thing that has been challenging is I'm totally new to B2B sales. This is my first like enterprise role. And I have so much respect for salespeople. They're honestly, if you can do this job forever, like I think the benefit of being a startup founder is that if something's really hard, you're going to build the 0 to 1 and then you're going to pass it off and someone else will take it 1 to 10. So I feel like the only thing that keeps me motivated in the world of sales is I'm like, eventually I'm going to hire a really amazing sales lead and I won't have to do this anymore.
That is one thing that's always tricky, especially being a founder, is like you have very strong skill sets, but because it's a very small team, you kind of have to, the things you may not want to do or not that exciting or even not in your wheelhouse, but you're like, I talked to many technical founders who are like, I don't want to do sales, but I can't afford to hire a sales. So I have to learn to at least do my best and and there's so many different ways of doing it, but it's always that thing of realizing like very quickly you learn what tasks you don't want to do anymore once you raise enough capital or can be able to go market and get paying customers.
Yeah.
And it's funny for like, it's always typically it's sales because sales can be challenging, or it's like technical people being like, I don't want to do legal or contracting or web dev. So it's always an interesting conversation to have. As you're having these conversations, like obviously it sounds like in the healthcare space, very much knowledge, but when you're having, maybe when you've talked to other organizations or other people, is there still that big divide of confusion around, oh, like I don't need these benefits? Like the classic I've heard from other founders, like, oh, our team is very young, this is not concern for them, or the opposite, like, oh well, if it's very male dominant company. Do you still find there's a lot of stigma around that where I know we touched on this a little bit, where that education of like, hey, your employees probably want this, but because employers are going to be like, I want to get pregnant, I need resources, like you said before, it's not really as maybe openly talked about, maybe as mental health or like dental benefits, because everyone's like, I have kids, they have cavities, I need better dental. But some of these other benefits are more personal and private for a lot of these. Do you find that a pretty common topic of conversation and just educating, realizing like, hey, this is a more needed benefit than your team might be thinking because it's so private?
Yeah, no, that's definitely like a massive objection that we need to manage in our sales funnel, and totally expected, like totally understandable why this would be problematic. Like as I said, this isn't something where people will raise their hand when they're having this challenge. It is beneficial when people are doing like a benefit survey, or like when a HR team will roll them out, because we do see that they come through in anonymous feedback, that people are looking for fertility care or family building care. But it's definitely something that we are like constantly handling that objections with HR leaders, where they'll be like, oh, well, I have 100 employees. I only have like 2 women that went on mat leave last year. So, like, there can't be that many people thinking about fertility. And we always have to like pause that conversation and be like, okay, first of all, the people that need fertility or reproductive health care or family building services is not necessarily the people that are actually going on
Mhm.
leave. There are many people that are thinking about their reproductive health care proactively, which is great.
Yeah.
So, tons of people that are in their 20s and their early 30s that want to avoid a fertility crisis later on. And then the other big thing is the like female male split. There's a pretty big assumption that this is a women's health issue, and that's something that we're always having, like having that conversation and making sure people understand that this is something that is male and female related. And what's been really really helpful here is that we're just crossing to the point where we actually have the member data to be able to stand behind the fact that this isn't just something that your 30-year-old women are going to deal with. This is something that's much broader. So our data is finally demonstrating, like, for example, we have, out of our active members, 44% of them are male, which is really nice.
Mm.
Honestly, it's like
Mhm.
many men that I have like lovely conversations with our members, and they'll always be like, I know my wife in a heterosexual relationship is the one that has to go through the treatment. So I'm going to try and figure out the finances and make sure that we're working with
Mhm.
a good clinic. And it's really refreshing talking to all these men that are really wanting to take an active role in the family building care that they need. And also, the data has started to like stand behind the fact that there are a lot of people that are thinking proactively, and
Mm.
that's something we want to always be careful on, because the
Interesting.
topic of egg freezing is becoming like a little bit more popular, and but there is some like challenges there of, freezing your eggs is something that might help in the future, but there's no guarantees, right? And we want to avoid basically leaning into this feeling of fear that a lot of young people have of like, oh shoot, I have to go out and freeze my eggs. I have to go spend $15,000 because otherwise it's going to be a problem for me. What we're really encouraging is for people to say like, okay, let's get educated. Go do some testing, learn about your own body, learn about your own reproductive health care, and then make a decision from there on whether or not it's actually a time when you need to take action, but not basically trying to be like pushing on the fear, and making people spend money that's not actually necessary for them personally.
Mhm. I think it's very interesting. Even you were saying before, like my friends in the States, this is like all of them have had this conversation for the past 10 years. They're like, oh, like
I
I
went
went
in,
in, I
I might
might
do
do
X.
egg freezing. Like this is the plan. And, now I'm 25 or I'm 30. Like these are just a part of the schedule. Then you're connecting with people up in Canada here. And it's like, oh, I haven't even, like, didn't even know this was a benefit. I thought this was on my own. It's like the void is massive, especially being at the age I am. This is like a much more common conversation, I guess, in your early 20s, typically, because lifestyle. But I think now, like even me firsthand, seeing that divide of people realizing like the inability to get access to care, or even like you said, access to knowledge of like what steps should I take.
Mm-hmm.
Some organizations are saying like, oh, you have to freeze your eggs, or like, oh, it's guaranteed. But again, there's like, not, it's maybe not guaranteed. There's still,
Yeah.
and for some, like you said, sometimes there's a better option. Just being educated. I think education is such a big part of it, and even educating organizations realizing, hey, this is a common occurrence. Our people are very curious about this. Being a leader is extremely important. Do you, I always find this interesting, especially when I used to work in the benefits space. Do you find these conversations typically being more receptive or more interested from larger organizations, or is it those scale up organizations who are looking to give better benefits, or has it been really all organizations kind of interested in this?
Um, so I feel find the value that they're looking for is different in different places. So large organizations seem ready to actually make the investment of like
Mm-hmm.
putting dollars behind the
Mm-hmm.
care and the treatment. So for example, like when it comes to family building services, you can't really offer like a $500 lifetime maximum. Like it's just not
Mhm.
really going to make a dent when someone is going on a journey that's likely going to cost them
Mhm.
tens of thousands of dollars. And
Mhm.
so if an employer wants to offer coverage for it to actually be meaningful, they probably need to offer like 5, 10, $20,000. And so really it is larger organizations that are at the point where they can start to make those kinds of investments. We're seeing in the like SMB
Mhm.
space more of an interest on the digital health side without yet putting dollars behind it. And that's honestly an
Mhm.
amazing place to start. So when someone offers like our Sprout digital health solution, they're able
Mhm.
to basically offer all their employees the support navigating educational resources and help any employee that want to take action make sure that they're taking the right action. And a part of that service is we help them with financial planning. So we'll
Mhm.
help the employee understand, okay, this is what your total cost of care are going to look like based on your pathway. These are how your existing benefits could fit in. Like maybe you have a health spending account, maybe you have paramedical services. There's different ways that you can use your existing benefits to help cover. And maybe there's some provincial healthcare that can also be a part of the journey. So for an earlier stage company, starting with the digital health side without putting dollars behind it can still make a huge difference in that employee's journey.
Mhm.
And on top of that, we also have like discounts with providers. So even if they're not able to put, a lifetime maximum for the coverage, if the employee is starting on a journey with one of our providers, they'll be able to get a discount. And so it's kind of like they're getting coverage anyways. So we're finding that it's just like, it's not necessarily that different sizes of organizations are more or less interested in solving this problem broadly. The difference is really where do they have capacity to be able to invest.
Mhm. That's super interesting. I always find, especially when it comes to like reproductive healthcare, like I believe like a lot of maternity leave laws started out West Coast Vancouver, like that Canadian thing for really pushing it. So you would assume we were pivotal in that years ago, but now it's kind of depending on the healthcare. Like the U.S. is catching up or has surpassed us. So it's interesting. Once an innovator, now kind of not as innovative, especially when it comes to a lot of employee benefits and employee access to usable or manageable health. As as you kind of grow and scale this business and kind of have more of these conversations, how obviously, like you said, there's a lot of uncertainty. So like in maybe not the perfect world, but like when you look forward, what is your view of how this market can really develop and grow over the next 5 years? Like, what is your view on how this can really become better for Canadians or even internationally? Kind of where do you see the market going, shifting, and really expanding for better healthcare?
Yeah, so what's interesting is like because we have the analogs of what happened in the mental health space and then also what's happened with family building south of the border, both of those have seen a massive acceleration over the past 5 years. And so we really
Mhm.
think that we're at the starting line that like mental health was 5 years ago in Canada. Um, in the US, they went from basically like single digit coverage 10 years ago, and now they're at 50% coverage for like family building care broadly. And
Mhm.
those packages are just getting better over time as people
Mhm.
become more educated around the different pathways to parenthood, the different treatments that people could need, and the coverage options that should be included. So we really expect the Canadian market is going to follow that similar trajectory. Obviously, it can't happen all at once. But one thing that was exciting was the Benefits Canada survey from last year showed that 34% of Canadian employers wanted to add some type of fertility coverage for their employees. And considering we're at 2% now, like 2 to 34% would be a great
Yeah.
ramp up. So fingers crossed that that actually plays out. And so I think there's a lot of signal to say that like statistically this should be a quickly accelerating industry. But then I think what really drives this is honestly just what's happening with people today.
Mhm.
Women and men are having kids later in life. That's leading to issues with infertility because your reproductive health care just does decline as you age. We can't change that yet.
Yeah.
And families are forming in different structures. People are going to be looking for egg donors, sperm donors, surrogacy, adoption. There's so many different ways that you can build your family today, and that's not going away as we like continue to have a more and more open minds around like different family structures. And so I think it's really exciting to know that we're at a point where there's more awareness that this is a problem, and we're hopefully working towards removing the stigma on this problem so that people can actually start to push for the care that they need. So one of the things that we always try to encourage is that, like, if you're an employee at an organization and you're dealing with this personally, put that feedback on your benefits survey, or we have a form on our website. Fill it out and just say that we should reach out to your HR team and be totally anonymous. Like, while we don't want it to be something that people have to shy away from, we totally understand the career impacts of why you maybe don't want to raise your hand as an employee. But like, we'd love for people to know the conversation is changing. HR leaders are looking to make this adjustment. And so all they need is to be able to build the business case. So we'd love to help like put together that business
Mhm.
case for employees.
I think that makes a lot of sense. And like I said before, I've been talking to more and more founders, even internationally, looking to start addressing these issues because they're becoming more common. And like you said, it's not a problem that's going away, especially as people have kids later. It's a biological fact at this point until we can somehow reverse aging. But until we get there,
Yeah.
it's not something that it's like a quick fix, and it's just going to become bigger and bigger, especially as organizations kind of keep growing throughout this whole process. Obviously, a lot of like important information here. As we kind of wrap up here, if people want to learn more, get in contact, what's the best way to reach out, get in contact, learn more about how the services you offer?
Yeah, they can absolutely find us on our website, sproutfamily.ca, or I'm always available for a DM on LinkedIn, Suzanne Mason on LinkedIn. So would love to chat. It's honestly been really, really nice. Like, now that we've put ourselves out publicly as we're building this company, we're doing this thing, that we've had so many people reach out with their own personal journeys, sharing the different pathways that they took to parenthood. And for many people, hopefully like successful outcomes. So would love to just hear basically what this looked like for you, and if there's any way you think that this could make a difference within your organization or as an HR leader, something that you're actually contemplating.